Welcome, everybody. Thank you so much for joining us today to the 7 ways to take the scare out of giving care. My name is Paige Fairbanks-Gunn, and I am the one of the regional managers for Kelsch Senior Communities. I'm in the Arizona and Colorado region. I've been working with families and seniors in the dementia world for 25 plus years. Um, I have been working with probably, I would say, over about 6,000 families now in my career.
Wow.
Um, yeah, a lot, and continuing on. I'm definitely still in the grind in my working days. We have at Couch Communities, we have independent living, assisted living, but the majority of our communities are dementia care. So we're excited to have you here today, and thank you for joining. Pam?
Thanks, Paige. I'm Pam Ostrowski, and I'm a dementia caregiving expert and guide for people like you, basically. I wrote a book. It's not that simple, helping families navigate the Alzheimer's journey. And it really is about my 14-year journey with my parents and everything from conversation starters to the things you can expect to how to handle the emotional roller coaster that is dementia caregiving. It's a different kind of caregiving than any other kind. And if you're here, you probably know that. So that's so important. And so I want to do a few housekeeping things here. I want to remind you that November 18th is going to be our next webinar, and it's going to be on how do you handle the holidays. It's very difficult when you are in a situation where you have someone who needs attention and you're trying to cook, entertain, and do everything else. So the questions that come up, we'll make sure that we address all of those. So it's one of our favorite and most well-attended webinars. And so that's November 18th. And then the next one was going to be pretty quickly after that because of the Christmas and other holidays that happen at the end of December. And that one will be December 9th. And that's going to be about presence, not the presents, but the other presence, about staying present and about how we enjoy the holidays and events with our loved ones as they continue to decline with their dementia symptoms. So wanted to remind you of that. Also, if you've never been to one of our webinars before, this is really Paige and I talking about caregiver questions. It's not formal. There's no slide deck. There's no pictures. It's just us having a chat. And so you are welcome to put any information, questions, whatever in the chat. We ask that you don't solicit your services, but just if you have something you want to add, or more importantly, if you have a question, which is what this particular session is all about. And then if you don't want to receive any more of these, because once you're on the list, I email you and say, hey, here's the next one in case you're interested. You can either ignore that email or you can reply back to it to unsubscribe. Please do not click the unsubscribe button at the bottom of the email, because what that does is it dings my email, and then I'm not able to send out the emails as easily. So we would really appreciate it. Just reply back and say, hey, Pam, take me off the list. So there you go. So we've got quite a few people here. So remember that you can put your questions in the chat, and we will get started with the first question from one of our caregivers. Are you ready, Paige?
I'm ready.
All right. This caregiver says, my mom was just diagnosed with dementia. I'm worried about what this means to her quality of life. What do you recommend as next steps? I just want to make sure, Paige, she hasn't really alluded to where her mom is in the stages and symptoms. So we don't have too much information on that one.
Right. Well, with this question, I highly recommend that you find out what mom is doing and what she's struggling with. And over weeks at a time, not just one day at a time. And as caregivers, we find writing down observations are very helpful. So I would highly recommend that you get a notebook, start writing down things that are unusual about mom and making sure that you are checking the date and you're actually putting the time of the day so you can keep a log of what's going on. And this is a really good start to really start doing your research on some senior activity centers. Start looking at some engagement programs. What does mom like to do? What is her peer group like? Are there things that you could reach out to some of her friends to find out maybe she could get involved in? And this is also a time too where, if this is new and you're just starting this process with her, I highly recommend if you have something on your bucket list, I would highly recommend that you start doing that now. A big trip that you have planned, anything that you have that you want to do sooner is smarter and getting some of those fun things out of the way now.
Yeah,
That's what I would
yeah,
do.
yeah, I agree. I think one of the things that you pointed out that I really like is writing down your observations,
Mhm.
because it's especially like in my situation, my dad was with my mom all day long, every day, and I wasn't. So when I would go in, it would be like, wow, she's really not doing the things in the kitchen that she used to do. My dad was never in the kitchen with her. He didn't know. And then time of day. That's really important because, like all of us, we wake up in the morning and we're either morning people where you're perky and productive, or it takes a couple hours to kind of get wound up. But then the key hours of engagement are typically between 10 a.m. and 3 p.m. And then the wheels can kind of start to fall off, because everyone's tired. And so that's the reason, I think that that point is really important, Paige. The other thing that I would say is don't panic. Um, we didn't actually get a dementia diagnosis for a few years, but we knew what it was because she just stopped doing things and she didn't remember where she was at. And you just know some of the symptoms. And we have presentations and webinars on those. So if you guys would like us to send those out to you, just let me know and I can send out the link. But it's easy to panic. It's
Yeah.
easy to go, oh my God, she's got dementia. What do we do? And you've got time. You've got plenty of time. In the 99% of the cases, this is after diagnosis of a disease. So dementia is an umbrella term. It's not a diagnosis of a disease. So as the disease progresses, the symptoms are what determine or help the doctor determine which disease it is, what type of dementia it is. So once
Mhm.
you get, let's pick my favorite one, Alzheimer's. And with an Alzheimer's diagnosis, it's another 4 to 8 years typically that they have to live. So the key here is what Paige said, sooner is smarter. It's about seizing the moment. You guys remember the Dead Poets Society movie where he's a carpe diem, seize the day. Well, we need to live more like that anyway. But in this particular case, you definitely need to do what Paige had mentioned, which is start to travel. But do the things on your bucket list, either if it's a spouse or if it's a parent. If there's things that they want to do, help them do it. Get them on an airplane, go with them, right? Because this is part
Mhm.
your memory too. It's not just theirs. And assist them, be with them. They'll enjoy it more. And really, what the last thing that we as humans lose in the situation of dementia is our emotions. And so you want them to feel safe, you want them to feel loved, you want them to feel happiness. Seeing you happy
Mhm.
makes them happy. So it's all tied together to a lesson that we could all learn, whether we have dementia or not, which is seize the day, live in the moment, and keep her active and stimulated. If she wants to stay at home and sit in the dark, and I had a client who called me, excuse me, and said, "Mom won't leave the house." That was challenging because she just wanted to stay there and watch her favorite show and not move. And it was dark and she didn't turn on the lights, and it was really sad. And unfortunately, that type of situation can accelerate dementia, the dementia
Mhm.
symptoms and the disease itself. So you want to get her outside, go for walks, go to, if she's capable, volunteering and having her take puppies or dogs for walks or something that brings her joy. Knitting circles or, quilting circles, any of those things where she's still semi-functional. She doesn't have to be perfect. Her friends will understand. But you have to stay engaged. You've all heard the phrase, if you don't use it, you lose it, right? Usually it has to
That's
do with
right.
our muscles. But this is for this muscle, right? This organ. It's for your brain. So definitely get out there and make sure that you are doing the most you can to help her stay engaged with life because that will
Yep.
prolong her best quality of life.
That's
So,
right, Pam. And people live longer when they're around people. They do, and when they're engaged. And this lady's mom and everyone needs a purpose too. So
yes.
finding that purpose and staying active is key.
Yep.
Yeah.
Absolutely. Okay, what's next, Paige?
All right. Okay, Pam. My mom is worried that my dad's dementia is getting worse. She asked me if I think it's time to move him to a care community. I'm worried it's too soon. Can he go into assisted living if he has dementia symptoms?
Well, I know you have thoughts on this. So, and they're
Yes.
professional thoughts based on your years and years and years of experience, but I'll give my opinion because I hear caregivers say this all the time. As a matter of fact, I would say this is the number one question. When is the right time to move someone to memory care or to assisted living? And so my first question is, why would you think it's too soon to move your father to a place that provides a more supportive environment, whether it's food, activities, visual stimulation, sensory stimulation? Why would that be? How could it ever be too soon to do that? I think that we get into our old school beliefs around, oh, well, he would never leave the house. And we put boxes around how other people think because we look at them through our perspective, our frame. And the problem with that is that as this person evolves with this condition, they have different thoughts. And if you don't
Mhm.
allow them to have different thoughts about things, then you're preventing them from being in the best environment possible, possibly. So the biggest fear I think caregivers have is that most of us do not want, I know Paige will say, do your research. Um, right?
Yeah.
But there is something eerie or something really uncomfortable about walking into assisted living and seeing people living in that environment. There's just something in your heart that goes, this can't be my parent. And so that's when you go to a therapist and have a conversation about how do you cope with aging? How do you cope with your
Right.
parents aging, right? And because you have to get to that point where you accept that. And so when you walk into that space, and you can call in advance and say, look, I'm scared to death to show up. I really don't want to do this, but I know I should.
Right.
And, like anybody who's answered the phone and is going to be giving you, walking you around and talking to you about, what you're thinking about, which is what they should be doing, is going to tell you, look, every single person here has had that same conversation. That in the United States in particular, we have a real aversion to leaving our homes. Like we are
Mhm.
physically glued to our homes. And in
Yes.
reality, it's just a thing.
Totally.
It's
Yeah.
just a thing. It's just a box with lots of little boxes inside of it. And in reality, what feeds the soul, what feeds the mind, what feeds the heart is the support of a community and
Mhm.
engagement, music, good food, a happy hour, because assisted living
Oh
communities
yeah.
have happy hour.
Happy hour, yeah. Mhm.
um, and 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 going to the library and reading a book in the peace and quiet in front of the fireplace. I mean, there's just so many things that a house doesn't provide for
Mhm.
someone. And yet, somewhere in our brains is engraved, oh, well, mom really likes that recliner. We'll bring it with you.
Right.
And it's also it's an apartment for heaven's sakes. So, when we talk about moving, I think the caregiver fear is I don't want to go see one of those places. It's not a hospital. It's a docked
No.
luxury cruise liner. It's beautiful. So I challenge every single one of you on this call or who are watching the recording to make that phone call. And, if you want, contact a local placement agent and ask which ones are the best ones, or just look online and Google assisted living and look for the number of stars for the Google rating. But however you want to do that, go check it out. I'm not saying go to all of them, just go to one to see what it's like. And then the other question is, and this is what my parents did, is what's the current state of your mom's health? Is she kind of
Mhm.
wobbly? I mean, I don't know how old these people are, so she doesn't tell us. But like my parents, my mom was in her late 70s, my dad was in his early 80s. And I said, Dad, if mom can't cook for you, you're not eating well. This isn't working out for both of you. And so he went
Right.
into a community that, and I think all communities now allow for this. She went into assisted living, the building that does assisted living, because they have the caregivers for that training, with that training. And then he was independent. So they just left him alone. And then when he needed some help with medication management, they were there to say, here, we'll take care of that for you. And then
Mhm.
she moved to memory care. And so all they did was move up from one two-bedroom apartment to the other two-bedroom apartment that was just above them, that was a secured floor. So they were always together almost until the last year. And she got to be too high a level of care. So that's the other option is couples. So Paige, I'm going to hand off
Yeah.
to you because I know you're an expert in should it be assisted living? How do you tell if it should be memory care? What's the process? All that good stuff. So how does that work for this woman who's seems to be pretty afraid of assisted living?
Well, first of all, I think, if dad's dementia is worsening, the first step, of course, is you go tour a place and inquire, but also find a place, find somebody that can do a home visit assessment to really see where dad is, first and foremost. Because if mom and dad are together, and let's say they're married 60 years, I was in our memory cafe on Monday, and I mean, there are so many people that are married 55 and 60 years, and they don't want to leave one another. And that's totally understandable. And we want them to stay together. So, if mom is pretty independent and dad's dementia is worsening, then it would make sense for them to go to a community that would have maybe independent living and assisted, but also you want to make sure that you're finding a community that has the dementia care piece, the memory support. Now, if you're looking at splitting them, it's totally different, but it sounds to me most likely they want to try to stay together. But he could go into to assisted living, definitely with her. What gets to be the complex piece is that let's say mom wants to stay at home and she just wants to move dad. Um, they move dad maybe to assisted living. You have to make sure that dad is going to, if they do accept him in assisted living, they need to make sure that there is a memory support wing or area that he could live in when his dementia worsens. Because what happens is we have people in our independent living that have been diagnosed with mild cognitive impairment, and they're still doing just fine. But as the condition progresses, if they start to wander or they walk out of the community, I met with a family on Sunday, and she's living in an independent living community, and mom walked out the door and is sitting out front in a bench and is looking for a bus to come pick her up.
Oh boy.
So that right there, okay, that the independent living has now issued a move out notice because she doesn't understand. She's getting more confused. So that's the big determining factor is the safety risk. If dad's okay and not wandering and wandering out the door and is doing well in assisted living, that's fine. He can get quite a bit of care in assisted living. It's the safety factor that once that becomes compromised and if they start wandering and they're a potential elopement risk, that's when then dad would need to move to a secured, safe, more safe environment.
So where do you
Um,
stand so I used to live in Phoenix. I'm in Denver now, but I've seen lots of assisted living connected to memory care. I've seen
mhm.
what it used to be was all assisted living, but they saw the increased demand for memory care and thought it would be good to migrate across to memory
Yep,
care.
that's my
So
concern.
what's the scoop with how those caregivers, because I don't think someone in assisted living knows how to care for somebody in dementia. Is that a
That
thing? Is
is
that a valid
that is
concern or?
that is an absolute thing. I always make sure that, if somebody's going to move their loved one, let's say they move dad to a community that has memory care and mom's going to go to regular assisted living and maybe dad's going to the dementia area. So mom can walk down and see dad whenever she wants. I would be you really need to ask a lot of pointed questions to the community that you are looking at and really ask them how their training is because we've been in a national caregiver shortage I mean, I've seen it happening the last 10 years and it's been worse
Yeah.
since COVID. Anyways, we're into the repair mode. So what happens is when you've got an assisted living with a memory care attached, if the memory care caregivers, if there's call outs or they're short staffed, they're bringing the assisted living over to the memory care community. So you need to make sure that everyone is getting that dementia training at all times because when you just go to a standalone memory care community, that's all those caregivers know is dementia 24/7, 365. So those are the pointed questions you really ask about the staff training and making sure that when they do cross over staff, that all of their care staff are trained with, high level of dementia training.
Yep. And that's definitely a question to ask.
Yes. And in a
Okay.
Kelch community, our memory cares are just standalone. So that's all we live. And it's a very safe environment, and that's all we do is the dementia training. So
Right.
those would be my suggestions for families.
Yeah, and those are all great ones. I mean, ultimately, I think the thing that we're saying to you as caregivers is ask questions. Make sure that
Hmm.
the people who are caring for for your loved one have dementia care training and ask what it is. This is your
Yes.
right to ask those questions. And I've had so many clients say, "Is it okay to ask that?" Like
Of course.
it's
Yes.
it's your obligation. It's your
Yeah.
responsibility to
You're
ask
their
the tough
advocate. Ask
questions
lots of
because you're the
questions.
only one between your loved one and a care community. You need to make sure that you do your due diligence is the bottom line. So, okay, Paige, I got another question for you.
Okay.
So this one is a little sad. I've been caring for my mom who has dementia for 5 years now. Now we don't know if the mom's living at her house or vice versa. So this might not be quite as traumatic, but she says, I'm exhausted and honestly, I'm feeling resentful of constantly worrying about her. Do you have any suggestions?
Oh, yes. So, caregiver burnout, number one, is absolutely can be tragic at times. I have seen it happen too many times than not, where the caregiver gets extremely ill and then it's an urgent situation. Many care communities um, have respite stays. Usually, their respite stay is a 30-day minimum. But what respite stay is it's a short-term stay. So you as the caregiver, whether you're a spouse or a daughter in this circumstance, it's caring for, the daughter and she's probably dealing with work and she's exhausted and caregiving. She needs a break. So, looking into respite stay services in a community is definitely something that I would highly recommend. And there's also day stay programs. Our Kelch communities offer day stay programs in our assisted living. There are day clubs and daycare. They call them, I don't like daycare. We call them day stay, but there are what they call daycare, adult daycare communities in many cities that will offer hourly care. Those would be some suggestions as well. Um, but the respite care, if they come into a community and they're just basically staying for a few weeks. So it's like they're going on vacation. You bring their medications, you bring their suitcase with their basic necessities, and they're joining in, having the meals, having the activities, and we're caring for them while you, as the daughter, the adult child, gets the break and basically gets rest. So that's what I highly recommend. And if you do respite stays, make sure you don't tell everybody that you're doing it because everyone's going to call you and ask you how you're doing and you need rest. So,
Mm.
that is definitely, the respite stay and the hourly care. I would definitely be looking into something like that. And you can use
Uh,
it as frequent as you want too.
yeah. Yeah. Good. We had a couple of questions that I kind of attempted to answer while you were talking. Leslie asked, if you don't have long-term care insurance, how is assisted living paid for? I'm not quite sure. A spouse without depleting all of your retirement savings until Medicaid begins to pay. Medicaid doesn't pay necessarily. So let's back up. Assisted living and independent living and memory care are all private pay unless you have long-term care insurance, which is why long-term care insurance is so important. It at least gets you the first couple, 3 years of whatever community assistance you need. And then you can move into your savings and that type of thing. So if you're in a situation now, the guide program, and Paige is going to allude to this in a little bit, the guide program is new, but it requires you to be on traditional Medicare. And it does have some dementia related financial compensation. And we're not talking about paying for, a month's worth of assisted living here. So we're going to address this, Leslie. So hang in there with us because we do have someone who asked a similar question. And then Sylvie, thank you for the question, Leslie. Sylvie, thank you for your question. And she says, is there guidance on, this is a favorite of mine, on how to know when you need to think about moving? You already are thinking about moving, which means the answer is yes. My mom waffles back and forth about whether she should go to assisted living. She has short-term memory loss, but because we've lived in our home for so long, she remembers how to do things as long as she's still there. So all of her ADLs, but she does worry about how to know when she needs to go. I'm not sure how to guide her. So I suggested go do a 30-day respite at a care
Mhm.
community. Try it out. See how she does. That might awaken her to the fact that, she's not quite as stable. She's relying too much on routine
Yeah.
and not enough on learning and stimulating herself. Because that's the other thing is once we get into a routine, we don't think anymore. How many times have you driven home
Right.
and wondered how you parked the car in the garage? Like, how did I get here?
Right.
So,
Yes.
so,
Yes.
so same thing with this. If she's worried about it, she needs to go do a respite stay at, whatever assisted living, and she can try it
Mhm.
out. And if she doesn't like that one, she can try out another one. So that's kind of
Yeah.
a cool thing. Paige, what do you think of
Yes, you
that
can try
question?
before you buy. Yes, you can.
Exactly. And it's just a rental agreement and it's only month to
Right.
month. So it's not a
Right.
contract either. So there's
Right.
that.
All assisted living is month to month. So it's just a 30-day.
Yeah. Yeah. So that's a good thing. Okay, so then I need to respond back to the poor woman who's been caregiving for her mom for 5 years. So first of
Mm.
all, 5 years is a very long time for anyone to do
Mhm.
caregiving, especially on a day-to-day basis. Now, your mom has been very lucky to have you as her daughter, but you're going to collapse. I can't imagine what your relationships look like at this point. I can imagine your heart and your mind and your body are not in the greatest of shape because we internalize and worry 24/7. And if you
Mhm.
think about that, it's like trying to sleep with one eye open for 5 years. Like you literally can't shut your brain off because you're like, oh, I wonder if they gave her her pill. I wonder if they did this.
Yeah.
I wonder if she had that. I wonder if dad remembered this. It's just constant.
Hmm.
And it's torture is really what it is. So the best thing to do is, we've talked about this in a bit, but there's senior activity centers. Churches are a great place to go and say, hey, I've got my, mom really could use some external stimulation. And just because that she's having memory loss doesn't mean that she has dementia, by the way. It could be interactions of medications. It could be lack of focus, otherwise known as attention deficit disorder, or just busy brain. So there could be a lot of reasons why memory loss happens. So that doesn't mean that she has dementia necessarily. So she might light up like a light bulb when she goes to the church and starts doing a
Hmm.
knitting activity or a quilting activity or whatever. So find out what activities are available and then go with her. I know you're already exhausted, but you need to go with her the first time and
Yeah.
see how she integrates. She needs to feel safe, right? And you're the person she feels safe with. So you go the first time, you see how it goes, and don't be too hands-on. Don't be like, the helicopter child
Helicopter
where
daughter.
yeah, they have helicopter parents, there's helicopter caregiver children, and hover over her. Step back and just watch and she says, I'll be right here, mom. I have to take this phone call and just pretend like you're on your phone. You don't have to be on your
Mhm.
phone, but pretend like you're on your phone so that she looks over and she sees you're busy. So she'll be forced to engage. And that's what's going to help her brain and help her do better because if she's home alone and you're her caregiver, she's not getting the stimulation she needs and she's going to decline faster. The key here, the one caveat is if she's a wanderer, you will need to be there, which is defeats the purpose. So you're going to have to hire a companion or a
Hmm.
friend of the family or a family member to go along with her just to make sure that she goes to the bathroom when she needs to and knows where it is and those kinds of things. So whatever activity you get her enrolled in, make sure that you go that first time, make sure that she feels like she's safe, but that she's able to enjoy it. And just remember that this is what's going to give her the best quality of life for the
Yeah.
longest period of time. Oh, it looks like Leslie has another question. When your loved one is combative, well, I just dealt with this one. How should that situation be handled by a facility so that the caregiver can actually get a break? I have been caring for my husband for 5 years and had a bad experience for 5 days of respite.
Ooh.
Um, so it should be handled by a facility. So combative is usually the result of not feeling heard or of being in pain. So I don't know, Leslie, what stage your husband is in. So if he's in early, mid, or late. But usually, like with my mom, they tried to put her dentures in her mouth and she raised her hand and someone said, oh, well, she's being combative. And I said, she raised her hand because she has a sore in her mouth and you were trying to hurt her by putting the dentures in. I said, you need to
Mhm.
understand more about the situation than before you make a claim like if them being combative. He may feel like people aren't listening to him. He may not be able to hear very well. There's so many factors that cause this reaction, a negative reaction is what I call it, versus being combative. And the community, the care community should know how to handle that. Um,
Right.
Paige,
Yeah.
what are your thoughts on this?
Yeah, and 5 days is it's a hard 5 days is really hard on the one that has dementia for a respite stay. I highly recommend 2 weeks to 30 days, and
Yeah.
it needs to be, is everybody all on the same page? Did the care community and the family sit down and do a roundtable to find out, what was the assessment done? What kind of aggressive behaviors are we looking at? Because they get pulled from one area at home with the spouse and they get yanked and pulled to, another. How do we handle that messaging and letting him know that he's only here temporarily and what does that story look like? So yeah, it sounds like that they didn't handle it very well or have enough information in the beginning to make sure what was to come. And sometimes, and as care communities, we always have to improve and make sure that we're asking all the right questions. And sometimes we don't get all the information until someone gets into a community, we start seeing things. So it really is a level of transparency, so it can be really a successful stay. But
But
5 days is 5 days
no,
is not enough.
that they shouldn't have even allowed you to do that because
Yeah.
when people move into memory care in particular, it's a shift for everyone. And
Yes.
it's going to take them 60 to 90 days to really acclimate. And the more
That's
you
right.
interfere in those first 2 weeks, the more you're there visiting, the more you're there
It's
engaging.
very confusing for
It's
them. I
very
mean, it is
confusing for
so
them.
confusing.
It
Yeah.
is. And then in addition to that, the caregivers, they don't learn to rely on the caregivers. They don't learn to trust anyone because they're always depending on you. Now, if in this case in particular, I would say that that would be unfortunately the case. Now, what's sad, and I would actually tell you not to go to this care community, but that's my personal opinion based on what you just wrote, which is that they're medicating him to keep him calm. Now, that is not an unusual thing to do when there's behaviors of some sort, but I don't understand the way you've written it. No pain, just wanted to be free to move. So like they haven't put him in a straitjacket, but they probably have over medicated him. So you call the primary care physician or you talk to the
Mhm.
nurse and you say, he's a little too medicated. You need to back off by whatever the next dose is down. And you, as your head, as the healthcare power of attorney, have the power to say that, and they have to do it. Right, Paige? Do I have that
Sure.
right?
Yeah,
No. So,
absolutely. Yes.
yeah. And I
That
understand why they're
medical
doing
power of
it,
attorney,
but
yes.
they haven't found the right dose. And by the way, you gave him 5 days to find out what the dose should be. That is not the way medical science works. Everybody is different in how they process medications. So they probably thought, the easiest thing to do is to give him, I don't know what, 10 milligrams of Seroquel. And maybe 7.5 is the better dosage for him, or maybe 5. But you
Right.
gave them 5 days to figure that out, and no one can do that.
It's
So
not long enough.
it
Yeah,
isn't
it's
long
not
enough for
long enough.
everyone to get to know each other and figure out the reactions and that type of thing. So, yeah. So that 5 days isn't enough, is the bottom line.
Yeah,
Okay. All right,
absolutely.
Paige, what's my question? I think we're on number 4.
Yes. Okay. I did some preliminary research on how much it costs to have a companion care provider come to the house to keep my mom active. I've also looked into memory care communities and their costs. I'm not sure how long her money will last if we use either of these options. Any suggestions?
Okay, here's your money question. So, first of all, it depends on where her mom is at. As far, again, we always say it depends on what stage that the person's at. But I would use a phased approach. So we've talked about the senior centers and that type of thing, but probably the first conversation, the first person you should talk to when you're worried about money is to talk to your certified public accountant, your CPA, whoever does your taxes, to have them look at your finances and say, how much can we afford per month? Or talk to a certified financial planner who is a fiduciary. They both will give you an hour of their time for free. And you just need to bring everything with you or give them access to it in advance so that they can review it prior to your meeting. But they can basically make some recommendations as to how much money you have because you really can't go much further without knowing how much money you have and the recommended, you can spend in addition to your social security, you can spend an extra $2,000 or you can spend an extra $4,000. One of the things that you probably do not want to do is spend down your assets so that you can qualify for a Medicaid care community. You'd be better off doing traditional Medicare and going through the guide program and getting paid to be a caregiver. So yes, every single person
Mhm.
here, if your loved one is on the traditional Medicare and Medicare season has started, so you can switch from an Advantage program back to traditional in order to qualify for the guide program. And what that will do is it will allow you to get paid as a caregiver. I want to say it's up to $1,000, but I'm not 100% sure. Don't quote me on that. But you get paid. Um, so looking at those kind of things, going to your area agency on aging for your state, every state has one,
Mhm.
and ask them about how you can get reimbursed, how you can get paid in some way, shape, or form, or more importantly, are there any other programs? And then the next thing to do is phased approach is to start using those senior centers, senior activity centers, church groups, those types of things to give you some time away from them and to give them the stimulation they need outside of the home. Then you can get a companion caregiver. So if you look at there's a spectrum of caregivers that work for agencies that are between a companion who will take your loved one to the museum and to different events and that type of thing, all the way to someone who's doing toileting and showering and medication management and everything else. So that's obviously the more expensive version. And so ultimately, you need to start at the lower end to get your loved one used to having someone around that's not you, because this will kill you otherwise, especially if you're the same age they are. And so you need to get help. You can get professional help is the best way to go because those tend to make sure that they've been trained in dementia so they understand how to communicate. Sitting in front of the TV is not acceptable. That person gets fired on the spot because I've seen it happen. And it's like, no, that's not what we're paying you for. So making sure that they have that sensory stimulation, for a couple of hours every day. And because
Mhm.
otherwise they get tired, is the bottom line there. So those are some of the ways to phase into this. And Paige, I'm sure you have some ideas on this one too, to kind of because it's not inexpensive. Memory care is
No,
actually,
no,
it's
it's not. Yeah, Medicare doesn't pay for any assisted living or any care except for
no,
skilled nursing, and that's temporary.
right.
I mean, for example, I mean, my aunt's in independent living, and she pays 40, I think 4,700 a month.
How big is her apartment?
Um, Her apartment is about 800 square feet, but
Okay.
she's got her meals, activities, she has
But she has a
transportation.
kitchen too, right?
She has a full kitchen. Yes,
Yeah.
absolutely.
Oh, and a full living
But
room and a single
with her
bedroom.
Social Security and her pension, it that pays for it. So she's able to handle that. Now, when she needs care, that gets to be, of course, the higher level of care and the more services are going to equate to higher charges. But I would start talking to, maybe some home care agencies and looking at communities and finding trusted communities to help be a resource for you, to let you know, okay, what are some options? Was your spouse a veteran? Are you a spouse of a widowed veteran? There's some veterans aid and attendance out there. I know some people have been looking into reverse mortgages to pay for care. Apparently there's some new stuff out there. People are looking into that. That's also an option. Um, but as time goes on, if you do exhaust all your funds, Medicaid will pay for assisted living in many states. In Arizona, it will. I'm originally from Kansas, and we have the PACE program, but there are some Medicaid programs that will help. But finding your trusted source, someone that you're comfortable with, and then if you don't have a trusted source, you can always look at a placement agent. They can help you as well to try to help you find
Local placement agent, not a
local
place for
placement.
mom.
Yeah, local placement agent. Yes, please, local placement agent. And there's also options of, um, there's group homes too, which are less expensive. But it really is trying to find out what does your financial portfolio look like and what does your monthly budget look like? Because nobody plans for long-term care. I mean, my husband and I, we're planning to get long-term care when he turns 55. I'm 50. It's the fear of the unknown. And if you don't want it taking all of your savings, Long-term care is definitely for those adult children on the call today. I would highly recommend looking at, and you can get, a 3-year term. You can get all sorts of different terms of long-term care. So get it now before someone gets a diagnosis.
Right. Well, and the other thing about Medicaid that I just want to clarify what you said, Paige. Medicaid just doesn't kick in and you get to stay in a fancy community that you really like.
No,
There
no,
are
it's
specific,
limitations.
there are
Yes,
specific locations that are
that's right.
Medicaid
Approved.
part approved, yes. And they tend to be where people are that really can't afford care. And
Correct.
so the reason why I mentioned why we mentioned the professionals, the financial planner and the CPA is that there is a crossing point where having in-home care, taking care of you in your home, not only does it not provide all the stimulation that you need unless that person's mobile, but it becomes more expensive than a care community.
Hmm.
So a lot of times the care community with everything that it's got, so bear in mind that this is a care community includes everything. It includes food, laundry, housekeeping, entertainment, a van to go to fairs and musicals and all sorts of events. So it is literally an all-encompassing solution for that
Yep.
4,200 or 4,800. I forget which one you mentioned. And so it's not just not just the mortgage, it's an
Right.
all-encompassing solution. So those are
Right.
the things, the factors you need to weigh when you're looking at the money side of things. So hopefully that helps. Okay, Paige, our next one is both of my parents who are in their late 70s are showing definite signs of aging. My mom has been diagnosed with mild cognitive impairment and early stage of dementia. She doesn't cook much anymore and has stopped knitting, something she used to love to do. And dad just sits around to the house and watches TV. How fast does the decline happen? So
Okay. Yeah, this is a question that many
that's
people
called a roll of the
ask.
dice, right?
Yeah, it is. It's kind of like that crystal ball. There is no way to tell the length of time anyone has. However, it sounds like this adult child is concerned about mom and dad's quality of life. And it's mom's needs are more. It sounds like mom needs more stimulation than dad is able to provide. And sitting at home in front of a TV. Now, maybe they were, I mean, hermits all their life. I don't know. Everybody's circumstance is a little bit different. But if they are not engaged, I will tell you, and it doesn't have to be daily engagement, but if they're not going out and doing something on, a couple times a week, weekly basis, and they're not being engaged, the less stimulation that they get, the worse they're going to become, unfortunately, because it's not good for their brains or their hearts or their condition at all. And I will tell you, if they begin to fall in the home, each fall causes a decline. Now, I'm not talking about a bump and trip, just, stumble, but if they fall on the floor and they're falling, and that's where the decline really starts to take place. And usually the spouses are covering for the other one. Oh, mom didn't fall. No, she just bumped and hit her knee. Well, they usually always cover for one another. So it's,
Yeah.
as an adult child, it's really your due diligence is to really start really looking and really, you know, looking at details and asking more detailed questions and making sure that they're ultimately safe in the home too.
Yeah.
So the
Yeah.
decline, yeah,
And I don't have a lot to add to that. I mean, you really don't know how long it'll last. I gave some statistics earlier. But odds are they have, they could have anywhere between 5 and 10 years, 15 years. You just don't know.
yeah, never
Um,
know.
so
And
you,
what other comorbidities? Do they have
oh,
diabetes?
exactly,
Do they have
exactly.
congestive heart failure? Do we have AFib, coronary artery disease? What other things are going on with them, physically? So there's a
All
lot
right,
to
Paige, let's
consider.
get to number 6 because we've only got a few minutes left.
Okay. I feel like it's my responsibility to take care of my parents who are in their late 70s. I feel guilty that I don't want, but also don't feel qualified. I don't have a clue on how to help them What if I do something that causes them more harm than good? So the responsibility of taking care of your parents and you're afraid. That is
Yeah.
scary.
So I lived this, so I feel
Yeah,
pretty
you did.
qualified. And I mean, I felt guilty if I didn't go see them and often enough. I felt guilty because I left my dogs at home. I felt guilty because I left my boyfriend at home. I mean, there's just you just are inundated with guilt. And
Hmm.
so
Yes.
it comes down to whether you or they have the means to get professional help, so bring in the in-home care or to go to a care community. Um, I I believed, and I had to persuade my dad that going into a community living was the best thing possible. And he said, I don't disagree with moving to a community. I disagree with the timing. And I said, what did you feed mom today? And I said, all I see in the refrigerator is milk. I see cereal in the cabinet. I see soup in the cabinet. And I see frozen White Castle burgers and fries in the freezer. I said, she just got through colon cancer surgery. She can't eat any of this stuff. So, what are you
Right.
feeding her to keep her alive and keep her well? And I said,
Hmm.
that is my biggest concern. And he couldn't respond to that because he's not a cook. And so I said, let's go tour some places, see what you think. And my mom liked all of them, God love her. But, the stimulation was wonderful because
Hmm.
he was independent and they have a pool table. And so I bring my dog and my mom would pet my dog and sit on the sofa and watch us play pool. And my dad and I never played pool together. And I'm not good at pool, and which is an underestimation and something he was very clear to me about afterwards. He would beat me every time and he would laugh at me and be like, really? What made you think that shot was going to work? We had more laughs than I thought we'd had probably in the previous 5 or 10 years because he was in an environment where he was not under stress. He didn't have to worry about taking care of her. We were doing something that he was good at, and I wasn't. And those were happy memories. And so I am grateful to that community for providing those. So I definitely think that if you're afraid that you're going to do more harm than good, then it's time to allow professionals to help out and help care for your parents. And you go be the daughter and you don't have to worry about being a great caregiver. Paige?
Right. Well, if you're worried about doing more harm than good, it's definitely time to seek help and support. Good for this adult child knowing their self well and knowing their limitations and their worries. I work with families daily who are in this type of situation, whether for independent assisted living or memory support in a memory care community. These families are relieved to know to talk to somebody with experience. I'd be happy to sidebar with anybody. We'll put our information in the chat, but it's, the biggest thing about this one right here to this question is her parents are in their late 70s. Sooner is smarter. Start talking to your parents about this or your loved one about this sooner, and having these conversations. So it's not, so it doesn't creep up on you if a crisis happens as well.
Yep, I agree. Leslie, I just put a message in the chat saying
And I
that
saw hers.
I'll email you because we need to help you out a little bit and we don't have necessarily the time to provide you with specific information. And we really want to get to this next question because I think everyone here has lived this. So Paige, this one's for you. I'm worried about my health and my mental well-being after caring for my dad for 4 years while raising my own children. My husband is saying that he can't take much more of this lifestyle. So things are rocky. I'm so torn emotionally. What can I do?
Mm. Yeah, this is sad, and I'm sorry. This adult child's going through this. That's hard. I hear stories frequently from adult daughters, and it's mainly always daughters. I'm actually in a similar situation myself. I am working a lot. I'm very full time. I am helping care for my aunt, who is in independent living, but yet there's a lot of behind the scenes that I'm helping her with. I have adult children, and I also have a new grandbaby. So lots of generations going on. So I feel for this daughter. The key is having boundaries, and what I do is I set a schedule. So getting with your family unit, I have to make sure that I set aside time that, every other Friday night I do date night with my husband. Every Wednesday night, my husband and I, it's either myself or my husband take my aunt out to eat. We get her out of her independent living and we take her out. And then usually she always comes and stays overnight. If we can do it every weekend, we do, but I'm trying to kind of make it more of every other weekend. And getting her, used to, trying to be engaged, because she's not living with me, whereas this daughter is caring for, her dad, living with her. So just setting those boundaries, and I think, asking your family to help you. I asked my brother as well. I'm like, hey, can you take a couple shifts for me to, do appointments, doctor's appointments, and scheduling doctor's appointments, my appointments on the same day as hers, so we can take the day off together. That helps. But also, again, this is just to me, it's helping. It's calling out respite stay, day stay, engagement programs for her dad to get involved in. So you've got to care for yourself. Caregivers, we all have to self-care, and we don't always do that well. Actually, I know many caregivers that do not do that well at all. They give everything to their loved one, whether their parent, their spouse, and then they start to run out of battery, and it can be life-threatening. It
Right.
can.
And I mean, I remember just sitting in the parking lot outside the care community crying because I was so exhausted. And I knew that um, my parents weren't in a situation that I would have wanted them. I mean, they were lively people. They were funny. They were entertaining. We did everything together. And then it ended and I wanted more. And so there's that sadness that comes with being in this situation to start off with. But you have to take care of yourself. Your parents would never want you to be in a situation where you're exhausted, you're not able to
Mhm.
function,
Right.
you're tired all the time. However,
Hmm.
I have some tips where we need to practice moderation. Now, how many times have we heard that when it comes to what we put in our mouths, what we eat? And it's like, no, not the whole chocolate cake, Pam, just a piece of it. And I'm not good at moderation, I'll just admit it. But you don't have to go to every sporting event of your kids. Ask your kids, which ones would you like me to go to? What are the most important ones? We can switch it around, but I can't go to every single one. Talk to your husband and say, well, I need some help, which are the hardest words to say. I think for everyone, I need some help. But instead say, what ways do you think you might be able to help me out? Here's a list of stuff that here's my list of stuff that I need help with. What would you be willing to sign up for? And I can guarantee you he is not going to do it the same way you do it. And we call that perfection when it's
Yeah.
us. It's my perfection, not necessarily his. He did it perfectly to his standards. So let it go. We are and have such a need to control. I want not a speck of dust on the table. Well, as soon as the dog shakes, guess what? There's dust
There's
on the table.
hair. There's
Yeah.
dust. Yeah.
So it's a thing, right? So you don't have to visit your parents every week or every day. Substitute a phone call. I know I have a lot of friends who are caregivers who call their parent, every night. Hi, how are you doing? And it's like a 5-minute phone call, just checking in on you, everything going okay. Do you have any questions, anything I can help you out with? And then hang up. But that at least gives you the drive time back. And
Yep.
then, of course, once you get there, you're like, oh, I should do a load of laundry. I should help them with this. I should. It's a snowball. right? It
Yeah.
starts out as a snowflake and it turns into a ball, which then turns into a snowman, by the way. And it just keeps escalating and you will
Mhm.
spin out of control. Now, the good news is you're not alone. There are tools and things that we can do to help you out. But ultimately, if you keep doing the same thing over and over again and expect different results, that is the definition of insanity.
Insanity. Yes, that's right.
So we need to change it up, you guys. And if you have questions or want to run something by us, Paige and I have both put our contact information in the chat in order to help you out. We're here for you. You can email us. Our
Mhm.
email addresses are everywhere. And Leslie, if you could please send me, reply back to one of my reminder emails so that I have your email address. There's more than one Leslie in my database, unfortunately, and I'm not sure which one is you. So if you could just reply back to one of the reminders, that would be great. And so if there's no more questions, I want to remind you, November 18th is our next one. And it's about how do you handle the holidays when you have
Mhm.
someone with mild cognitive impairment, early stage dementia, mid stage, late stage. How do you have a good holiday? And
Yes.
how do you live your life and still involve your loved ones? And so we're gonna that's it's complicated, right? And we want you to feel happy and feel good inside and feel like you're doing all the right things. So, oh, thank goodness I need the holidays. Holidays have been bleak.
Oh,
Oh, it's
yes.
sorry, Sylvie. Yes, we will do whatever we can to help you.
Yeah.
And if you want, reply back to any of the reminder messages I've sent out and tell me what specifically, when you say they've been bleak, you can describe what they felt like to you, what's
Mhm.
happened, and then tell us what you'd like them to feel like. And that way we can
Yes.
kind of give you some tools on how to get to that point. That's what we're really
Yeah.
here for.
Yeah.
Paige, did you have anything you wanted to add?
I don't think so. I just want to thank everybody for joining, and we appreciate you watching. And like Pam said, our information's in the chat. Please reach out. We're here to help.
All right, you guys, take good care of yourselves. Always reach out to us if you have any questions, and we'll be in touch and get back to you and try to help you as much as we can. Okay, take
Bye,
care.
everybody. Have a lovely evening.
Thank you. Take care. Thanks, Paige.
Thank you, Pam.